Welcome, everyone. Today, we're diving into a topic that honestly is a massive blind spot for so many of us. I mean, we all know the big names when it comes to menopause, right? The hot flashes, the mood swings, that lovely brain fog where you can't remember why you just walked into a room. But it turns out there's an invisible symptom that most of us just completely overlook.
It really is. It's a huge part of the picture that's so deeply connected to our hormones, but it just rarely gets the attention it deserves.
Exactly. And we're talking about a part of your body that goes through this huge transformation, but it's often misunderstood or just not talked about until it's become a pretty significant problem. We're talking about your mouth, your teeth, your gums, even your jaw. To help us connect all these dots, I'm joined by our resident medical expert. It's so great to have you here. It's great to be here. And this is such an important conversation because with the right information, these issues are very, very manageable. But what happens is people often suffer in silence, and they think it's somehow their fault. And that is exactly our mission for today. We are going to uncover that surprising link between hormones and your oral health, and most importantly, give you a real survival kit for navigating these changes. Did you know your gums might be the canary in the coal mine for your hormones?
Most people have no idea, but the biological connection is absolutely undeniable. And once you see it, you really can't unsee it.
Let's kick things off with that fundamental mouth hormone link. Okay, let's get right into the basic biology. I think for most of us, we hear estrogen and we think of the reproductive system, maybe skin health or heart health. Why on earth does our mouth care about estrogen? That's a fantastic question. And to answer it, we have to kind of shift our thinking. We need to stop seeing the mouth as just a chewing machine and see it for what it truly is. It's living, responsive, mucous membrane tissue. And the key fact is, the tissue in our mouth is just packed with estrogen receptors. Wait, really? Where are they? Oh, they're everywhere. We find them all through the gums, in the salivary glands, on the moist lining inside your cheeks, that's called the oral mucosa, and even deep down inside the jawbone itself. Wow. So our mouth is literally wired to listen for hormonal signals from estrogen? Precisely. It's constantly waiting for instructions. So when estrogen is high, like in your 20s and 30s, it acts as its primary support system. It drives rich blood flow to the gums, it tells the body to produce lots of collagen to keep the tissue tight and firm, and it stimulates saliva production. Basically, it keeps that whole environment lush, hydrated, and well-defended. There's so much guilt and shame tied to dental issues. We automatically assume if something's wrong, we've done something wrong, we've been lazy. It is a physiological change, it is not a moral failure. All right, the real timeline. Let's really pin this down, because I think a lot of people listening might be thinking, well, I still get my period, so this doesn't apply to me yet. This sounds like a post-menopause problem. Is that accurate?
No, and you've just hit on probably the most dangerous misconception out there. These hormonal symptoms very often start well before that final period, during perimenopause. We see women in their mid to late 40s who are experiencing significant changes while they are still cycling, sometimes pretty regularly.
We are absolutely talking about that transition phase. In fact, if you look at the timeline here, xerostomia, which is the medical term for dry mouth, it commonly begins 2 to 3 years before menopause is officially reached. 2 to 3 years before. So you could be walking around dealing with these symptoms for a really long time without ever knowing the root cause.
A very long time.
Yes. So here's the key takeaway. If these mouth changes appear alongside sleep issues, hot flashes, or irregular cycles, hormones are very often part of the cause. It's not just a dental hygiene issue. It's a systemic change. Okay, so if I'm in that perimenopause window, what are the specific signs I should actually be looking for? What can I see or what can I feel?
Well, it's a mix of visual and sensory cues. So visually, you might just notice your gums look a little bit redder, maybe puffier, just more inflamed than usual. And a classic sign is when your gums start to bleed more easily when you brush or floss, that telltale pink in the sink.
Even if your routine hasn't changed at all.
Especially if your routine hasn't changed. And then from a sensory perspective, you might feel that persistent dry mouth, maybe increased tooth sensitivity to hot or cold things, or even subtle changes in how things taste. And some women just describe a general, hard to pinpoint soreness in their mouth.
Let's focus on that dry mouth aspect for a minute. Xerostomia. You mentioned it can start early, and honestly, it might sound like just a minor annoyance, but it seems like it's a much bigger deal for our overall health. So why is saliva so important? And first, I want to be really clear about what we mean by xerostomia. This is not just feeling thirsty after you go for a run. This is a constant, nagging lack of moisture, a feeling that drinking water doesn't really seem to fix.
So you just can't get that hydrated feeling no matter how much water you're drinking.
Exactly, because the tissue itself isn't holding on to the moisture in the same way it used to. It's a completely different physiological state. You know, we take saliva for granted, but it is the absolute unsung hero of our oral health. It's an enzymatic powerhouse. It does 3 critical jobs for us. First, it neutralizes the acid that bacteria produce after you eat. Second, it physically washes away leftover food particles. And third, it actually deposits calcium and phosphate back onto your tooth enamel, which keeps your teeth hard and strong.
So it's basically giving your teeth a constant protective bath.
It's liquid armor.
That is the best way to think about it. So when estrogen levels drop, it's like the tap for that liquid armor gets turned way down. You lose that protective shield. And when the shield is down, the risk for cavities just skyrockets. Specifically, we see a huge jump in what are called root cavities.
Why the roots in particular? What's going on there?
Well, it's really a double whammy. The gums are often receding a little bit because of that loss of collagen we talked about earlier. This exposes the root surface of the tooth, which isn't covered by that hard white enamel. It's a much softer material. So without enough saliva to wash away acid and bacteria, those newly exposed roots can decay incredibly quickly. And beyond just the risk of cavities, how does this actually affect day-to-day life?
Oh, it feels terrible. It creates this sticky, tacky feeling in the mouth that can make it really difficult to swallow dry foods like crackers or bread. It can even affect your speech, and a really big one is that it wakes you up at night.
It wakes you up at night? How does that happen?
Yes, you can wake up literally gagging for a sip of water because your mouth and throat are so parched. So on top of any other menopausal insomnia you might be experiencing, you've got this. It becomes a real double whammy for fatigue.
You mentioned gum recession a minute ago. Let's talk about the structure. You said earlier there are estrogen receptors in the jawbone. Does that mean our jaw is at risk too?
It absolutely does. Estrogen is critical for bone metabolism all over the body. We all know about the risk of osteoporosis in our hips and spine after menopause. Well, the jaw is a bone too. It's susceptible to the exact same loss of density.
And the jawbone is literally the foundation that holds our teeth in place.
Exactly. So if that foundation starts to weaken, teeth can become loose. But even before that happens, that loss of collagen can cause the gums to thin out, become more fragile, and recede away from the teeth.
I want to ask you about something that just sounds really distressing, and it's called burning mouth syndrome. What is that?
It is very distressing, and it's largely because a patient will come in feeling like they've scalded their entire tongue on hot coffee, but when we look in their mouth, the tissue appears perfectly healthy.
So the pain is absolutely real, but there's no visible cause for it?
Exactly. It's considered a neuropathic issue. We believe the nerve endings in the mouth become hypersensitive and start to overreact to all the hormonal fluctuations.
And is it true that this can also affect your sense of taste?
Yes, the medical term for it is dysgeusia. Women might report a persistent metallic taste, almost like they're sucking on a coin, or a bitter or even a rancid taste. And sometimes food just loses its flavor entirely.
That must really impact your daily enjoyment of things like food and drink.
It really does. But I do want to offer a little bit of reassurance here. These specific issues, the burning and the taste distortion, they often do improve over time as the body adapts and settles. They aren't always permanent.
All right, what can we actually do about all of this?
This is the most important part of the conversation. It is absolutely manageable. These are not things you just have to live with or accept. With the right proactive care, you can prevent tooth loss, you can stop gum recession, and you can be comfortable.
Okay, so let's start with what a professional might recommend. What are the options?
Well, for the dryness, we often suggest over-the-counter products that contain xylitol, which not only moisturizes but also helps fight cavity-causing bacteria. We might prescribe a high-concentration fluoride toothpaste to give you extra protection. For burning mouth, there are specialized moisturizing rinses that can help soothe the tissues. And of course, there's the option of hormone replacement therapy.
And does HRT specifically help with these oral symptoms?
The evidence strongly suggests that for many women, yes, it can reduce these symptoms pretty significantly. But I have to stress this. HRT is a complex medical decision. It's not right for everyone. It's a conversation you need to have with your primary care doctor, but you should absolutely include your oral symptoms as part of that bigger picture discussion.
Okay, so for those of us who want an action plan we can start like today, what does that daily survival kit look like?
All right, here it is. 5 simple steps. Number 1, sip water all day long. Don't chug it, sip it to keep your tissues consistently moist. 2, stimulate your own saliva by chewing sugar-free gum, preferably one with xylitol. 3, upgrade your hygiene. Brushing twice a day with a fluoride toothpaste and flossing every single day is now completely non-negotiable. 4, audit your mouthwash. Go look at the bottle. If it has alcohol in it, throw it out. Alcohol is incredibly drying. And 5, feed your bones. Make sure you're getting adequate calcium and vitamin D.
When to call a professional? That daily toolkit seems very doable. But what are the red flags? When does this cross the line from something I can manage at home to something that needs an immediate appointment?
There are several very clear red flags. If your gums bleed every single time you brush for more than a week, it's time to call your dentist. If you notice any teeth feeling loose, or you feel a change in how your bite fits together, if you can actually see your gums receding, your teeth literally start to look longer. And finally, if you have chronic bad breath that doesn't resolve, or a burning sensation that persists for weeks on end, don't just live with it.
And actually, we need to change our whole thinking about the frequency of professional care during this time. For many women who are in the menopausal transition, we now recommend professional cleanings every 3 to 4 months instead of the standard 6.
So increasing the frequency of cleanings is the new normal here?
Yes, because things can progress much faster now. We want to catch any inflammation early and remove that plaque buildup before it can cause any real damage.
It's really about being proactive instead of reactive.
Exactly. And it's also really important to know that your dentist is part of a wider team. So depending on the issue, your dentist may also need to involve a periodontist, that's a specialist for gum or bone problems, or an oral medicine specialist for things like persistent burning, dryness, or unexplained pain. Menopause-related oral health really benefits from a team approach, coordinating with these other specialists and even your menopause healthcare provider.
This has been so incredibly insightful. It really drives home the point that everything in our body is connected. We can't just put our oral health in one box over here and our hormonal health in another box way over there. Absolutely not. You cannot separate the mouth from the rest of the body. It's one system. So the big takeaway is that our hormones have a direct line to our mouth. And when estrogen drops, the risks definitely increase. But with awareness, simple daily habits, and maybe more frequent dental visits, we can absolutely keep our smile healthy through this whole transition. That's it, perfectly summarized. And if I can just leave your listeners with one final thought, it's to reframe how you see these symptoms. I want you to think of your mouth as a window into your systemic health. If your mouth is showing these signs, the dryness, the inflammation, it's a visible signal of what's happening throughout your entire body. It's your body's way of waving a flag. Pay attention to that flag. You aren't just saving your teeth, you're getting a much clearer picture of your overall health.
That is such a powerful place to end. Listen to your body and especially listen to your mouth. Thank you so much for breaking all of this down for us today.
It was my pleasure. And thank you all so much for tuning in. We really hope this explainer helps you navigate your own health journey. If you found this information valuable, please consider sharing it. You never know who in your life might be struggling with these invisible symptoms in silence. Until next time, take care.